So a lot of people come and ask me, doctor, do I have arthritis? Well, that's a very nice question, but put in a different way, there are a lot of varieties of arthritis. Depending on the variety of arthritis, the treatment also changes. So, what is arthritis? Arthritis is essentially wear and tear of the joint lining surfaces. In Hindi or Marathi we call it वात. वात क्या होता है essentially? आपका जो joint का lining है वो धीरे धीरे खराब हो जाता है. There are multiple varieties of arthritis for shoulder. One is osteoarthritis. It's an age-related wear and tear of the shoulder. Essentially, the joint lining erodes the cartilage which lines the joint. Eventually, it's eroded and then the bones start to rub on each other. Then there is a second variety of arthritis called rheumatoid arthritis. So, rheumatoid arthritis is an autoimmune disease. That means your body's natural defense mechanism, the antibodies start acting against your own body. So, this will lead to gross destruction of the joint lining, the cartilage. It's essentially an erosive form of arthritis. So, typically जैसे osteoarthritis में जॉइंट लाइनिंग खराब होता है उसमें बोन्स स्पर्स बनते हैं बट इन रोमेटॉइड आर्थराइटिस देयर इज सेंट्रल इरोजन ऑफ द जॉइंट द थर्ड वैरायटी ऑफ आर्थराइटिस इन द शोल्डर विच इज कॉल्ड कफ टियर आर्थ्रोपैथी सो इसमें जॉइंट के अंदर आर्थराइटिस से ज़्यादा आपका हाथ ऊपर नहीं उठता है बिल्कुल उठना बंद हो जाता है क्योंकि इतना मसल टियर हो चुका है because the rotator cuff has become so poor in quality that they cannot contain the shoulder joint. Now, depending on the variety of arthritis, your treatment also changes. So, if it is osteoarthritis, typically it affects only one shoulder. People have pain on one side, and if diagnosed early, it can be managed with physical therapy, anti-inflammatory medicines, ice application on the shoulder, probably injections in the shoulder. However, when people present very late, then certain form of intervention is required with which we can restore the mobility and function in the shoulder. When it comes to rheumatoid arthritis, it's a typically different ball game. Rheumatoid arthritis typically has a onset in early adulthood or above 60 years of age in women. Women are more commonly affected with rheumatoid arthritis. The treatment essentially involves closely working with a rheumatologist to control the disease process itself rather than directly taking care of the orthopedic problem. Interventions are required when people present very late, when there is end stage arthritis, when the joint is already destroyed with rheumatoid arthritis. Third, a cuff tear arthropathy. So, a cuff tear arthropathy generally with individuals who are not able to lift with the shoulder with pseudoparalysis generally require some form of an intervention like a reverse shoulder arthroplasty to improve the shoulder function and strength. So, there are multiple treatment options based on the disease which an individual is having. Having pain in the shoulder doesn't mean you're having arthritis, and having an arthritis doesn't mean that you need surgery. So, if you're having pain in your shoulder, first get it checked by a shoulder specialist and see exactly what you're having, then consider the appropriate treatment for that.